Hey everybody, I want to talk to you about golf swing today. Now, to really perfect your golf swing, see a golf professional, a golf pro. That's not my wheelhouse, but what I can help you with, you and your patients, is to be able to shift your weight from one side to the other, and especially from the right side to the left side. That's what golf and rotational sports are about, is to be able to shift weight from one side to the other and then be able to rotate and power through. So let's start with a review of PRI, that we have a tendency to be lateralized to the right side. And air in the left side of the chest wall becomes a more dominant force, pushing us over to the right side. And the reason for that is because the size and shape of the diaphragms, left versus right. Now, in a typical human pattern, you'll have a tendency to have more inhalation on the left side as opposed to exhalation on the right side. And that beach ball of air inside the left chest wall pushes us over to our right, as well as this lower chain of muscles starting from the diaphragm, called the left anterior chain, that shoves us over to the right as well. It also turns our pelvis over towards the right. We call that a right-oriented pelvis. And then what happens, we have a tendency to have a left counter rotation because we do have to walk and be able to look straight ahead. Otherwise, we'd be walking sideways. So in terms of a golf swing, one of the problems people have is the ability to turn their pelvis or their hips and come through with their hips and get on their left leg effectively so they can follow through after they've hit the ball. Now the problem with that is this, and you've seen this with golfers. A couple of injuries are really common. Number one, low back pain. Why? Because of over-rotation of the lumbar spine and that torque that is expressed into the discs. And over time, you know what that does to the discs? It blows them up. Not only that, if you cannot turn a pelvis effectively over a femur, torque not only has to go to the lower back, but it will go down to that left knee as well. So the key is to be able to turn a pelvis over a femur head. You would think, well, gosh, can I just stretch my way through there? Not really, not effectively. So this PRI approach says, okay, how the heck do I get over on my left foot? And if my diaphragm then is in a more flattened, hypertonic, contracted state on the left, that means I've got more air on the left side of my chest wall pushing me over to the right. I've got this chain of muscles pushing me over to the right, and I have got to figure out how to shift my weight and then be able to turn. So the first thing we do in PRI is to teach our patients and athletes how to take a pelvis, tip it posteriorly. We have techniques. They use a hamstring, for instance, and even a left adductor. That's just for starters. So we need something to anchor a rib cage down to, and I'll tell you why in just a moment. But first, when we take that anteriorly tipped pelvis and we put it in a more neutral position, now we're able to take a rib cage and anchor it down to a pelvis. Now when that happens, and how that happens, is through full exhalation. And you'll notice in PRI, our techniques, I always talk about respiration, especially exhalation as being one of the most important, or not the most important part of respiration, because typically people are hyperinflated and stuck in an extended state. Then they try to get more air in using shoulders and accessory muscles of respiration. So this is kind of a big deal to be able to exhale fully, anchor a rib cage down via IOs and TAs, and a little muscle inside the chest wall called the triangularis sterni, especially the left side, to get that air out. So what's the purpose of getting the air out? Well, when you can exhale on a nice neutral pelvis, that changes the shape of the diaphragm. That gets the diaphragm now to ascend, to, on the left side, become more domed shape. Now we call that a zone of apposition. PRI didn't invent that. You can look that up and Google it. There's a lot of research or articles on the zone of apposition. That just tells us that the diaphragm is in a nice dome shape. And imagine if you've got a dome-shaped diaphragm, it's almost like you have two big ball bearings in the chest wall that you can rotate around. And that's a lot better for a structure than trying to rotate in an extended position, hammering discs and hammering facet joints. So once you are able to find and feel a new position to go into in your body, hamstring, glute, adductors, abdominal wall on the left side, magical things happen. And what happens is this. I'm going to grab my pelvis model. So in this basic human pattern, we're in a state of pelvic right, we call it orientation. Now, if we went to pelvic left orientation, what does that look like? It looks like walking. But what's driving that? What's driving that is really this nice little harmony with the diaphragm. That's when we say walking and breathing are essentially the same thing. Here's what I mean. If you can take a flattened diaphragm on the left and dome it, you will then be able to inhibit that diaphragm, and here's a little PRI, what we call nugget. Whichever side the diaphragm domes, that pelvis will turn to that same side. When that diaphragm domes, it ascends, it relaxes, it also has an effect, a neurologic effect on the psoas, iliacus, TFL, vastus lateralis, and biceps femoris. Now what happens as you have your legs and your femur set, you are now able to turn a pelvis over a femur. We call that acetabulum over a femur. That's called internal rotation. So in PRI speak, we call that AFIR, acetabular femoral internal rotation. Now you can go the other way. You can wiggle a leg, and that would be FA, either ER or IR. But the point is, we want to think about turning that pelvis over a stationary femur and do it in such a way that it doesn't torque a knee and it doesn't torque a low back. That you've got freedom of movement without restriction of air in the left chest wall, of a chain of muscles on the left side that are hanging up and prohibiting your ability to actually express power in a relaxed fashion through your entire structure. Where does power come from? It comes from the pelvis. And if you're trying to muscle it with an upper body by itself, you're losing out not only on a lot of your power, but also it's going to be fatiguing. And in the long run, it's going to tear up structures. So in PRI, we teach this position sense that most people love the right side of their body. And this is a review of other videos that I have recorded. But that position in the pelvis is called right AFIR. We're okay over here. And correspondingly, there will be left AFER when you're in this, what we call left AIC pattern. The goal with PRI, the goal with your athletes, the goal for rehab and performance, because you know it all blends together, is you want to be able, through a series of chains of muscles, respiration guided by neurology, that would be training, to restore a nice balanced movement pattern. And the goal, again, is to be able to go through a sequence of repositioning and actually turn a pelvis over a femur so you can follow through on your golf swing. Take care, and we'll see you again.